Alexa. I'm a student nurse. I'm going to be demonstrating today how to prepare or administer a continuous heparin infusion and also do chest tube safety checks and chest tube dressing change. So first off, I'll just enter my patient's room before I administer the med. Hi Wendy, I'm Alexa. I'll be your student nurse for today. We'll be giving you heparin and doing your chest tube dressing change. So first I'm going to start with her wristband.
I'm just going to make sure that I have the right patient.
Wendy Holmes, right Finn. I'll check with my MAR and my orders afterwards. But Finn, 35 years old. Can you verbalize your name and your birthday? She can. We're checking here the tubings of the chest tube. See, there's no kinks or coils. There's jacuzzi bubbling in there, which means that there's an air leak, so we'll have to check for clamping. I see that I have my hemostats here that I will check for clamping. I'm just going to leave these here until I look at that over there. We're also supposed to have a water jug here, just in case the tube got dislodged, but I don't see one at the bedside, so we can grab that after. I see that it's on continuous low suction, so this is good here. And the suction is on the side. Okay. And I also want her to have her head of bed at about 30 degrees just for lung expansion. So I will fix that afterwards. But first we're going to deal with the clamping. Put my gloves on just in case.
Do my checks. So I have my physician's order. Okay. Here for Fred Frederickson.
So I'm also going to be assessing the site while I do the clamping. See, the dressing is dry and intact. No subcutaneous emphysema. All the tubing is connected. There's no gaps in the tape area. Okay. So with clamping, I'd want to start as closest to the chest tube as possible to determine if there's probably an air leak in the dressing itself. So take both of the forceps and then just disconnect this here. It's a little easier. Remove. Okay. And then I will clamp. And the bubbling stopped. So the air leak is above the clamped area, and we can fix that right away because I'll be doing the dressing change. So I'll initiate the heparin first, and that could run while we're doing the chest tube dressing change. Okay, Wendy? Okay. Site looks good here where the IV is going in. I see my other nurse has connected the Gravity TKO as the carrier for the heparin. This is hanging here. I just have to connect it to the primed Y site already. Okay, so for demo's sake, I will not spend time moving the head of bed up, but I would want it to be at least 30 degrees. Okay, so my safety checks are done here. Patient's not in any respiratory distress. I'm going to start with my heparin here. Okay, so my calculations ahead of time. We have the physician's orders with the MARS here. So the order, okay, this is just for the chest tube. This would be the order sheet for the heparin as well. So no low dose, infusion of 1350 units an hour, and it's for maintenance therapy. I would want to know CBC, APTT before I give this. Monitor throughout, want to watch for bleeds with the heparin. And yeah, so we'll do our first 5 checks. So Holmes, Wendy, Finn, 1, 2, 3, 1, 2, 3, 4, 5, 6, 4, 5, 6, 7, 8, 9, 7, 8, 9, 35 years old, Dr. Amanda Jackson. The route is IV for this. The time is now. The heparin is 25,000 units in 250 mLs of normal saline, so the right drug and the right dose, which is 1350. So right patient, drug, dose, time and frequency is now, and route is IV. So we did our first check. According to my math that I prepared ahead of time, we have the heparin, 1350 units an hour, the volume is 250 mLs. 1350 divided by 100 units per ml, which is the final concentration, indicates that it would run at 13.5 mLs an hour on the pump. Okay, so we did our checks. I'm going gonna bring this with me to go do the second check. I'll also need another nurse in here to do the third check and confirm the pump rate and everything with me. Okay, Wendy, I'm gonna initiate the heparin here. Okay, so again, can you state your name and your birth date for me? Okay, good. Wendy Holmes, 35 years old, March 21st, 1963. Okay, so again, compare with the papers here. Wendy Holmes, Finn 1, 2, 3, 4, 5, 6, 7, 8, 9, 35 years old, and the right drug is heparin, the right dose is 1350 units an hour, the right time is now, the right route is IV, and right patient, drug, dose, time, and okay, right patient Wendy, right dose is 1350, right drug is heparin, right time is now, and the route is IV. Okay, so I did my second check. I know my blood work, and now I see that we have it hanging here ready to go. The Y side is primed. I see that this is portless tubing, which is important for the infusion. The carrier is running at TKO via gravity. They're compatible solutions. And all we have to do is connect it to the Y site. Before I do so, I'm going to put in my pump here. So the rate, I'll put my sticker on here too. Heparin, 1350 units an hour. Final rate I said was 13.5 mLs an hour. So the rate is 13.5. The volume is 250 mLs. Okay, so I'll confirm that before I press start. I'll get my buddy nurse to come in and double check that with me. So she's here. She's checking the right patient again. Wendy Holmes. Right drug, the heparin. Right dose is 1350 units an hour. 1350. Right route is IV. Right time is now, and yeah. So those are my, patient, drug, dose, route, and time. So I did my 5 checks again. Okay, so yeah, because it's already primed, I would have my clean hands as well. I would alcohol swab this. Sorry. I would not swab that part because it would have a cap on it. I would swab the cap of the wide port.
Now that I've connected it, again, I'm going to go ahead with my second nurse. We're going to do
okay, third check is done with my second nurse. So before I press start, open my clamps. That one's good. I can press start, and I will wait till I see 3 drops there.
So now I'm going to do my third check with my buddy nurse, and she's going to...
For demo's sake, we see 3 drops. This will be running. I will monitor for any signs of acute bleeding, keep up with the lab work, and yeah, wait for the infusion to finish. So now that I got the medication part done, I will work on the chest tube dressing change. And like I said, because there is jacuzzi bubbling, I clamped it at the air leak. I will fix this and hopefully the air leak stops. If not, I will notify the MD or clamp down the tubing distally from the patient and check out where that air leak would be originating from. But for demo's sake, we can assume that it's from the dressing, and we'll change the dressing and the air leak can finish. A few more safety checks with the chest tube I would like to mention is that it's at -20 here, and the orange bellow would be in the window, which I believe the sticker is to indicate the orange bellow. I would want to know the amount of drainage from the start of my shift, the color, how much is coming out per shift from report as well, and also the air leak meter, which there is, so we'll deal with that. Okay. Wash my hands. Okay, so I would like to get my patient in a position where I can access chest tube dressing. So it's okay if I lift your arm up like this? They said yes. Okay, so first step, I will set up my tray. I'm going to take some clean gloves, put them on, remove the old dressing, and then put some new gloves on and start the dressing.
So
Okay.
I'm just gonna go up here. I see that there's the right amount of fluid in there.
So I know that there's some overlapping from the table, so I can't touch any of the sterile area that was
I'm going to
from the
take
table.
my,
I'm gonna let that little
Don't really need this
so that ends
or this.
our demonstration. I'm also gonna document on the MAR that I
my
gave
safety
at
kits.
the end with like
Maybe I'll just get
Also, following the rights of the heparin administration, I would of course document, educate the patient, know they have the right to refuse treatment at any time, and
And I'm going to make sure that
moving on
it's
to
my
here.
normal saline as well as my
okay.
and my
So I will pour my water in
normal saline.
very carefully.
Hygiene. So I know this is still the same patient I had earlier,
Patient,
and
so
I
that
am
if
doing trace dressings on them today.
Okay.
if the continuous bubbling stops, I know that it's fairly early, and then if not, I'm going to continue.
And of course, while I'm doing this, I'm making sure Wendy is comfortable, her breathing is okay. I would listen to her lung sounds as well.
Get my patient in a comfortable position.
Make sure they're consistent with the previous findings.
So we're just going to get you comfortable here, okay? Alright. So can you check that? I have that chest tube exposed.
Which it is at 90. So this is good. We're gonna put this back in.
Make sure not to put the forceps too far in because I touched them pretty far down.
And the order was to have it at the cold point at 60. So it's at 60, meaning we need to have the oxygen at 10. That's an extra
Making sure I don't touch the gauze.
all the way
Now I need my trach dressings for the chest tubes.
short, but in real life, this would be at the 10 when you're moving this. You should be able to be at the right place. So it's at 10, but
Okay, so it's near the water, but it did not go in.
down so you can hear me. There. So we're gonna follow this, make sure that
So I'm going to start by just removing this dressing.
Okay, and then I have my Jello net.
And
and
that
that
air
doesn't
seal
overuse that
on
line.
there. The jello net is what's causing it to seal. So
we're
I want to
monitoring
when I remove that, so I'm just going to set up my
So for any
sterile
trach care, we're also going to be wearing
little
gloves, of
slippery.
course, and a mask, but I'm not going to be wearing a mask today. For demo
Maybe I'll
purposes.
use the sharper
So I'm
ones.
going to also continue to go over the safety equipment. So we have normal saline here.
Technical malfunction here.
We have the ambu bag.
This tape is quite sticky.
There.
Patient, it doesn't
Okay,
quite as much.
so I set up my sterile field. I'm ready to go. I just need to take my old dressing off.
Another thing that you have to do safety check.
I'd want to do this as quick as possible because the Jello net is what's keeping it airtight, but maybe not because it's got a leak here. So
So I'm going to
disconnect this so I can work with this a little easier.
Coloring on this too.
So I'm going to want to stabilize the dressing or the tube as well when I'm removing the old dressing.
And my body open. Okay. So I'm just going to
so I
pass that to my dressing.
I'm assessing the site. As I mentioned earlier, when I palpated, there was no subcutaneous emphysema. Okay, they would be sutured in. The tube will not patient like that. Just be careful when I'm removing it.
Okay. Put on a new set of gloves.
And so we're going
The site appears healthy,
pre-oxygenate
no drainage.
with the O2 sac on, and we're going to
Okay,
instruct him to take 2-3 deep
okay.
breaths. He'll take 2
So I will deal with this afterwards. I'm just going to dress this while I can. I'm going to take these forceps, remove the gel net. Here I can see the site even better. Yeah, site looks healthy, it's stitched in. Bubbles are still going, but it's because we have not changed it yet. Don some clean gloves.
take this off, so use this so
My extra
help him over.
forceps here.
I would have an extra pair of gloves here at the bedside.
Can I set my garbage bag up over here?
Okay, first up.
Great, thank you. So we're gonna suction it. So I have this here, and this is a size 7 tray.
Okay, so I did not contaminate the tips of
Mine
those.
is 2 times 2
Push these
equals
out.
10, meaning we need a 10.
They're both still sterile at the
a
tips.
10 French half.
I'll start out with cleaning the site.
Here.
So I'll make my rosettes. Okay, so usually these are waterproof on either side, but because this one appears not to be, I would not use this because the germs could soak through onto the glass. So I'll just make my rosettes in my container here.
Not by the stoma there. And I just note the color and drainage of the stoma. So I'm just going to open my gel net right now.
Okay, it's between the 80 to 120. I'm going to take this out.
So I will use a circle motion all the way around.
And we're going to insert this.
The tips of my forceps slightly touch the chest tube, so I could ask a partner to get me more forceps so I don't contaminate the rest, but for demo's sake, we'll just verbalize that.
Until I get some resistance or...
Okay, so
the
now
micro
my
adhesion, so I hit
Another little rosette here. Oh, tip didn't touch. Okay, I'll do one more round, kind of further out and away. And then I'm gonna do one more wet gauze down the length of the tube.
I don't need to do another pass just because all the secretions are
Clean that a bit. I will have cleaned the entire site that will be underneath the occlusive dressing.
still, of course,
Okay, another pair of forceps that have been contaminated, but I would ask a buddy to bring me more. So for demo's sake, I'll just put these back here.
and I'm going to assess.
But I know that I would have to get a new one. This is squished out and dried off, so I'll just go down the length of the tube a bit. It's one swipe per swipe. I got underneath the tube when I did underneath the dressing. Okay, so now I just have to dry it off.
So I'm going to prepare my stuff here. And I actually also need to check
now we'll just do
his
the top one.
Okay, again, one swipe per swipe.
Okay,
Okay,
so now that that's done, I'm going to do
There's
my
that.
gel net. So I'm just going to take my gel net here.
in reality, the chest tube would not move out of place because they're sutured in.
already suctioned in and I have to check this. So I would have
Okay,
an alcohol swab and I would clean this
one
in 30
more.
seconds.
It's completely dry.
Here.
And then I will do one more just down the length of the tubing. Okay, this is my
There you go. It's within the green. You want to do this. Pressure is fine.
Like motion. Wrap it around, and then we're going to make that.
okay,
Forceps are still sterile.
dried. Now I can put on my jello net. This is the finicky part. I have to peel it out from in the
Tight, keeping that in. Now I'm just going to grab my drainage sponges.
Just gonna put this here with Sir Frederick.
Okay, so I've got this. I'm gonna kind of twist it up like this so it can fit around the hole. Okay, so it's pretty wound up here.
Now just take my 4x4 gauze.
Sterile. I'm going to place this around the dressing or the insertion site.
On the side. So I'm just going to grab my index tape, which I've already dated and timed.
Making sure I do not touch the skin, although it's
And
cleaned,
that didn't touch this at all.
Make it fully inclusive.
and wrap this all the way around. Okay, jello net on. It's an occlusive dressing site. Get rid of these. Now I put on my trach gauzes.
And now this is the important part where I'm going to make it sure it's fully inclusive and that it's tented.
So I will
The tenting just ensures that if any pulling is going
one
on
way.
the tube, that it doesn't pull on the patient's site failure.
Here.
and I'll go the other way now.
Like that there.
Inside is still sterile.
Okay, so then I'll just clean everything up. I'll lower the bed to a comfortable position, make sure my patient's arm is back in a comfortable position. I'll perform my hand hygiene. I'll document with the nurse on the continuous infusion that we do, as well as noting the stoma site
Okay,
here.
so they're overlapping. I just need one 4x4 on top, and then we can put the Mefix on.
Drainage findings, and I'm going to make sure that everything's running well. And I think that's it.
Okay. Okay, so dressing's on. I don't need to be sterile anymore. I need to put on my Mefix.
still clear. I'm going to take it from the vein.
I need to make sure this is a fully occlusive dressing. So I'm squishing down any areas of possible air entry. Okay, that's good.
So now I'm going to do the
Sticky to the gloves. Fully occlusive. I'm going to tent the tubing. Okay, so it's fully occlusive all the way around, and I'll do my exit safety checks. I would clamp again to make sure the air bubbling has stopped. It did, so there was a leak within the dressing. We fixed that. Heparin is still running, and I'll resume the patient to a comfortable position. And that's it.